So, good evening to Incha Iman. My name is Shrikant from MLD 2243 Cytology 1 from semester November 2025, which is 2533S. So, today I will be presenting on negative for intraepithelial lesion or malignancy, or also known as NILM, focusing specifically on the cytology infections. This topic highlights how cervical cytology not only screens for cancer but also helps to detect infectious conditions. Without wasting time, let's jump into the introduction. So, the negative for intraepithelial lesion or malignancy indicates there is no presence of precancerous lesions, no malignant epithelial changes, or no evidence of cervical cancer. So, the negative for intraepithelial lesion or malignancy is classified under the Bethesda system for reporting cervical cytology. The negative in for intraepithelial lesion or malignancy does not mean the cervix is completely normal, however. So the non-neoplastic conditions may still be present, such as infections and also inflammatory changes. So the pap smear, also known as the Papa Nicolau test, is the primary screening tool for cervical cancer, which is also useful for detecting infectious agents and helps to identify inflammatory conditions of the cervix. Some organisms are seen directly under the microscope and they show characteristic cytomorphological patterns. So, the cytotechnologists must accurately recognize the infectious agents in the NILM samples and provide a correct interpretation for patient management and diagnosis. So the common infection agents that involved in the NILM, which is the negative for intraepithelial lesion or malignancy, are bacteria, fungi, viruses, and protozoa, and also normal vaginal flora. Let's go through and see details about the infectious agent and also normal vaginal flora. Let's start with the normal vaginal flora. The normal vaginal flora, also known as lactobacillus or Dordaline bacilli. So the lactobacillus is the normal vaginal flora, which includes aerobic microorganisms and also anaerobic microorganisms. They are the predominant organism in healthy women. So seen commonly when there is glycogenized intermediate squamous cells present, especially during late secretive phase of menstrual cycle, pregnancy, and also during the hormonal therapy. So what is the function of lactobacillus? So the lactobacillus uses glycogen as a substrate to produce lactic acid, which helps to maintain the vaginal pH below 4.5, which create an acidic environment. This inhibits the growth of pathogenic organisms. So, for the clinical significance, the abundant lactobacilli with minimal inflammation is considered as normal finding. However, reduced lactobacilli indicate disturbed vaginal flora, which could be increased risk of opportunistic infections such as Gardnerella vaginalis and also Candida species infection. So let's refer to the image provided in the slide. So let's go for the cytomorphology of the lactobacillus. So cytologically, lactobacilli appear as abundant, long, rod-shaped bacteria. They are seen in background of lysed intermediate squamous cells with cytoplasmic debris and bare nuclei. Cells may appear clumped together. This appearance is considered normal in negative for intraepithelial lesion or malignancy when inflammation is minimal. So next we go for the bacteria, which is the Gardnerella vaginalis, which the most common cause of bacterial vaginosis. So the bacterial vaginosis is commonly seen in young women and also premenopausal women, often associated with squamous intraepithelial lesions or SIL and also HPV infection, which is the human papilloma virus infection. This bacterial vaginosis is rare in postmenopausal women unless they are on hormonal therapy. So the risk factors include multiple sexual partners, IUCD use, which is intrauterine contraceptive device use, period pregnancy, medication use, spermicides, or smoking. So the clinical features will be many patients are asymptomatic with thin vaginal discharge, and the discharge may be fishy or ammonia like odor. So the pap smear performance will reveal about sensitivity of 80% and also specificity of 87% for the bacterial vaginosis. And the pathophysiology, which is the Gardnerella vaginalis, adhere to epithelial cells and disrupt the normal vaginal flora. The cytomorphology of the Gardnerella vaginalis. So the key diagnostic feature will be in the bacterial vaginosis will be the dirty appearance, which is the clue cells. So the cytomorphological feature, uh, squamous cells are coated with coccobacilli, and the bacteria extend to the cell borders or the margins, which provide a velvety or shaggy cell surface. Even it partially covered still qualify as a clue cell. So the lactobacillus are usually absent in this case, and the inflammatory cells are usually absent also unless there is a co-infection. So the background appearance when we do a conventional smear and also liquid-based cytology. So for the conventional smear, as referred in the image one, there is a granular blue sandy background, and for LBC, which is a liquid-based cytology, there is a cleaner background, which is in the image two. So the second bacteria is Actinomyces species. So Actinomyces species is a gram-positive anaerobic bacteria which cannot grow in the presence of oxygen. So the common species of Actinomyces species involved in the vaginal infection will be Actinomyces israeli, commonly associated with long-term intrauterine contraceptive device use, which is the cause of the infection. So the clinical features for this infection will be most women are asymptomatic with possible malodorous discharge, which is associated with pelvic inflammatory disease. So the inflammation may be present or absent. So the clinical significance for the actinomyces infection will be detection prompts the evaluation of the intrauterine contraceptive device use and then prevents the future pelvic complication and avoids unnecessary alarm when correctly identified the infection and also guides appropriate clinical follow-up to prevent recurrence of the infection. Next, we go for the actinomyces species cytological appearance in the pap smear. So, they will be look like dense blue or purple fuzzy colonies, intertwined bacterial filaments with radiating long thin filaments and sometimes pink or reddish staining filaments. So, we can refer in the image how it will appear in the pap smear and also in the microscope. Next, we go for the cytological appearance of actinomyces species under microscope for the pap smear. So they appear dense blue or purple fuzzy colonies with intertwined bacterial filaments or radiating long thin filaments. The filaments stain pink or reddish, which we can see in the image. So the third bacteria is the Leptotrichia buccalis, which is the gram-negative filamentous bacterium. This is commonly found in oral cavity, occasionally in the vagina, often associated with Trichomonas vaginalis infection, both seen together in 75% of cases. So diagnostic considerations for the Leptotrichia buccalis infection must not be confused with the artifacts because it looks similar. So the clinical significance, usually asymptomatic, low pathogenicity, indicates altered vaginal microflora, signals the need to evaluate for coexisting infections such as the Trichomonas vaginalis infection. Next, let's go for the cytological features of the Leptotrichia buccalis, which appear long, thin, hair-like filaments intermixed with the squamous cells, may appear repeatedly across the smear, which is can be seen in the image. Next, we go for Candida species. So the most common cause of Candida infection is the Candida albicans. So the overgrowth occurs when normal flora is altered. The predisposing factors for the Candida infection are diabetes mellitus, pregnancy, immunosuppression, prolonged antibiotic therapy, or oral contraceptive use. So the clinical presentation or symptoms of the Candida infection will be thick white curdy discharge with no odor and with vulvar itching and irritation. So the inflammation may be present or absent. So the important thing that need to be reported will be pseudohyphae, which is the cytomorphology of the candida. Pseudohyphae is an indicative active infection. So must be reported even if asymptomatic if the patient lah. So additional findings will be reactive squamous cell changes and also mild epithelial irritation. So the clinical significance for the candida infection will be confirms the fungal infection in negative for intraepithelial lesion and malignancy, guides treatment and follow up for treat the infection. So next we go for the Candida species cytomorphological features. So they are mostly long segmented pseudohyphae which is protruding from the squamous cell clusters, and then the round to oval yeast forms where the yeast cells stain pink. So now let's talk about protozoa, which is the Trichomonas vaginalis. Trichomonas vaginalis is a protozoan parasite which causes trichomoniasis, which is associated with the vaginitis, cervicitis, urethritis, and pelvic inflammatory disease. So, the Trichomonas vaginalis infection increases the risk of HIV transmission. So, it is very important concern for the public health. So, the clinical features or the clinical symptoms for the trichomoniasis or the trichomonas vaginalis infection will be frothy yellow-green vaginal discharge, mulderous discharge, vulvar itching and burning, postcoital bleeding, and some patients may asymptomatic. So let's see the Trichomonas vaginalis cytological appearance. So they appear pear-shaped or ovoid organisms with pale gray or blue or green cytoplasm. The size is similar to a neutrophil or a small parabasal cell. So there is an acentic crescent-shaped nucleus which is important for the diagnostic. So the flagella of the Trichomonas vaginalis are usually not visible. There is red cytoplasmic granules may be present, and the background features for the Trichomonas vaginalis will be watery or dirty due to the neutrophil aggregates, which is known as the cannonballs. So now let's go for the viruses. So the first virus is human papilloma virus. So most common sexually transmitted infection worldwide. So most infections are self-limiting and also clear spontaneously by its own. But some HPV types are associated with genital warts and also cervical cancer. There is vaccination. So the vaccination is significantly reduces the HPV related disease. So human papilloma virus cytomorphology. So cytomorphological hallmark of the human papilloma virus will be coilocytes. So the coilocyte features are superficial or intermediate squamous cells, larger perinuclear halos, and well-defined hollow margins, where enlarged irregular nuclei present. So additional features that can be found in the microscopic examination will be hyperchromatic nuclei and binucleation. So the significance in the negative for intraepithelial lesion or malignant will be HPV or the human papilloma virus cytopathic effects without epithelial lesions help to guide the screening and follow-up decisions. So, human papilloma virus cytomorphology. So, cytomorphological hallmark of the human papilloma virus will be coilocytes. So, the coilocyte features are superficial or intermediate squamous cells, larger perinuclear halos, and well-defined hollow margins, where enlarged irregular nuclei present. So additional features that can be found in the microscopic examination will be hyperchromatic nuclei and binucleation. So the significance in the negative for intraepithelial lesion or malignant will be HPV or the human papilloma virus cytopathic effects without epithelial lesions help to guide the screening and follow-up decisions. The last causative agent or the infectious agent will be cytomegalovirus CMV. So this is common in immunocompromised patients. So the diagnostic challenge with the cytomegalovirus will be the infected cells by the cytomegalovirus may mimic tumor cells. So the cytological feature will be markedly enlarged cells with large eosinophilic intranuclear inclusions, prominent halo around nuclear inclusion. So which will appear as owl's eye in like in the image. So the cytoplasmic inclusions also may be present. So the importance of the cytomegalovirus cytomorphology is to differentiate it from the malignancy, and this will indicate the immunosuppression in the individual and also prevent misinterpretation in the negative for intraepithelial lesion or malignancy cases. So now let's talk about the diagnostic limitation and challenges in the negative for intraepithelial lesions or malignancies in cytology infections. So first, the pap smear is a screening test, not a confirmatory test for the infection. So there are limitations which include low organism load, obscuring inflammation, and poor specimen collection. For example, trichomonas may degenerate and the viral changes may mimic malignancies. For example, the cytomegalovirus. So conventional smear provide dirty background which organisms may be obscured, whereas the liquid-based cytology provide cleaner background but possible reduced organism concentration. So, due to that, important to do clinical correlation, microbiological culture, or molecular testing, or any additional tests to get accurate identification for the infection. Because the accurate identification prevents misdiagnosis, patient anxiety, and delayed treatment. So now let's talk about the laboratory and clinical relevance in negative for intraepithelial lesion or malignancy. So the negative for intraepithelial lesion or malignancy cytology, which detects the infection despite normal epithelium. So the role of the cytotechnologies in this will be they help to identify the subtle infectious changes and support early treatment of the patient. So this also benefits in the way to prevent PID, which is the pelvic inflammatory disease, and also reduce the sexually transmitted disease transmission. So the laboratory impact from this will be it will support the quality assurance and also contributes to public health surveillance. For example, actinomyces detection guides the IUCD, which is the intrauterine contraceptive device assessment. And the NILM cytology also is an integral part of cervical screening programs. In conclusion, negative for intraepithelial lesion or malignancy does not exclude clinically significant findings because cervical cytology detects infections and identify inflammatory conditions. The NILM should be viewed as a cancer screening tool and also an infection detection tool. Accurate cytomorphological identification ensures the correct diagnosis, guides treatment, and prevents complication. So the infection detection in negative for intraepithelial lesions or malignancy is important in public health for reducing the long-term reproductive complications and supports STI control programs. So in this, cytotechnologists play a vital role in patient care, support infection control, and contribute to successful cervical screening programs. And this is the references I have used to do my presentation. And that's all from me. Thank you very much.